The Ministry of Health is set to vaccinate teenagers aged 15 to 18 years against COVID-19. Health CAS Dr. Rashid Aman saying that children can be carriers of the virus even though they are asymptomatic, and there is need to contain the disease, especially in schools.
The plan to roll out the teenagers' vaccination drive across the country follows Health CS Mutahi Kagwe's directive on Sunday. This in line with the approval of Pfizer vaccine by the World Health Organization for use on children aged 15 years and above.
Beyond our adult population, we must also vaccinate some young people who, in most cases, though not bearing the burden of the disease, are carriers, and some of them are also spreaders. As such, it is important to get them vaccinated to reduce their chances of transmitting the virus.
According to Health CAS Dr. Rashid Aman, the ministry has been worried about schools in the past as a breeding ground for the virus because of the interaction between teachers and children who in most cases are asymptomatic.
Children under that age also can be asymptomatic. They don't have a symptom. So really, this may be areas where transmission needs to be stopped. So in that sense, I think even WHO has found it necessary that it be extended there. Now, the details of that, we will have to sit and I'm sure that even as we talk, we're going through strategic planning on how to achieve that. And once that is firmed up, I'm sure that there will be a multi-level government participation, clearly also involving the Ministry of Education, because that's where children are found.
Dr. Aman said parents may not need to give consent before their children are vaccinated because vaccination for all is a public health measure.
I have to get back to my technical team to find out what the thinking is on how to do it and how it's been done in other places. But I think it's a public health measure, so probably you would not need a consent. I think. I could be wrong on that. Don't quote me on it. We need to look at that. My view at this point is this is a public health concern, and we need to reach all members of our population that we can with the vaccine.
As of 23rd of November, a total of 6,494,091 Kenyans have been vaccinated, which translates to about 9% of the total population. 2.4 million of these have been fully vaccinated, while 4 million have received the first dose of the vaccine. The top 5 counties in terms of COVID-19 vaccines in regards to fully vaccinated people are Nairobi with 25.6%, followed by Nyeri County with 20.4%, Kiambu 15.2%, Taita Taveta and Laikipia both at 12%. And the top 5 counties with the smallest numbers of fully vaccinated people are Wajir with 1.9%, Tana River 1.9%, Turkana 1.7%, West Pokot with 1.6%, and Marsabit with the least with 1.4%.